Welcome to our video where we will continue exploring the role of blood pressure. This time we are moving away from the normal blood pressure and we will shift our focus on when and why issues arise with the blood pressure. We will also have a look at the control of blood flow. So let's get started. I want to begin by noting that there are many things that can affect one's blood pressure. These include individuals' age, sex, weight, even race, posture, amount of physical exercise that one is used to, emotions and mood, and the medical state of an individual. For example, whether a person has a fever or not will have an effect on blood pressure. Let's consider two possible larger situations where the blood pressure is off from normal, and we will start with hypertension. The key here is in the part that says hyper. So this is a state of constant elevated blood pressure, and I believe that the cutoff point that your textbook offers is 140 over 90 milligrams of mercury, and of course anything above that. And we try to catch the hypertension before it becomes medically diagnostically significant and prevent the patient from developing this. So why is hypertension dangerous then, you might ask? Well, an individual with a hypertension has a greater risk of heart failure, vascular diseases, renal failure, this makes sense as the kidneys filter the blood, and an elevated risk of a stroke. Let's see how this also results in anatomical changes in the heart, an organ that we studied in our last chapter. Well, on hypertension patients, the heart muscle ends up having to work harder and the myocardium becomes larger in size, functioning weaker, and it is also just flabby. Of course, there is also a risk of the plaque building up. Some of the risk factors associated with hypertension include hereditary factors, diet that is high in fat and cholesterol, obesity, age, diabetes, stress and smoking. Often there is no clear cause, but this may be multifactorial, and we will never be able to pinpoint it into one particular reason. So, what can you do to reduce your risk of hypertension? Well, some of the things that you can do are, for example, lowering the salt, fat, and cholesterol intake, exercising more, losing some weight and stopping smoking, so lifestyle changes. And of course, if those do not help, to assist with those pharmaceutical interventions. Now, I want to talk about another kind of blood pressure issue. In hypotension, instead, the blood pressure is less than normal. A cutoff given here is 90 over 60 milligrams of mercury. Do notice that this is not usually an issue, so we would rather deal with this than with a too high blood pressure. When it becomes a problem in a medical sense, I guess, is when there is insufficient blood supply to the tissues due to low blood pressure. Then this would be an issue. Some have even suggested that this may be beneficial, and some findings suggest a link with long life expectancy and lack of cardiovascular illnesses. There are those subgroups of hypotension that I want to talk about. Why don't we have a look at those now? In temporarily low blood pressure, an individual may feel dizzy when suddenly standing up or reclining in a seat. In chronic hypotension instead, there is often either a link with poor nutrition, alternatively this may be an indication of a risk of developing other conditions. And finally, in acute hypertension, there is another reason for the loss of blood pressure. Usually it is an indicator of a patient going into a shock. And I just wanted to remind you of the signs and symptoms of a shock. So an individual would appear pale, have cold and clammy skin, show as having a fast and shallow breathing and/or fast and weak pulse, appear agitated, be possibly thirsty. And all of these would be signs that the individual may be heading into a shock. So how do we treat someone who is going into a shock? Lay them down so that they do not fall from high if they do go into it. Raise the feet in order to direct more blood to the head. Loosen any tight or constricting clothing. Calm down the patient and monitor their progress. And of course, we want to treat the cause, whatever is taking the patient into a shock. One common cause for going into a shock would be a loss of large amount of blood. Okay, I think we are now ready to shift our focus on how we control blood flow in the body. Remember that the flow is constantly controlled and adjusted so that the rate of flow is exactly correct for the particular organ or structure and its needs. And there are extrinsic and intrinsic controls that play a role. Let's look at those. So, extrinsic control relies on sympathetic nervous system and hormones to control blood flow. And note that this level of control would act throughout the entire body. So, for example, the smooth muscle on arterioles could be affected by the sympathetic nervous system and hormones in order to direct blood to or away from the areas depending on if they need or do not need more blood flow. And then our intrinsic control is all about responding to local needs through controlling capillaries. So we are responding to specific tissues requirements at that site, only at that site. So capillaries can be modified on an organ level, responding to their needs too. I think that this is a great illustration of this. See how normally about 20% of blood flow is directed to skeletal muscles, but this amount can grow up to about 70% during exercise. Another one to consider is the brain. The blood flow to there is constant, as the neurons die easily, as you learned in our module on nervous system. The brain really cannot handle too high or too low blood pressure, so we have special adaptations to ensure that. And then let's mention skin. Skin has a very responsive adaptation to control the blood flow to and from it. This is because it plays such a major role in thermoregulation, and I should also mention that the skin is a major blood reservoir. Next, lungs. Lungs require a low blood pressure, as they cannot handle high pressure with all the capillaries that are only equipped with a very thin wall. So we have a low blood pressure there. Finally, the heart. Well, we have already talked about it in our previous module. Now, I want to talk quickly about the speed of blood flow at different parts. Let's have a look at that a little bit. And what we end up noticing is that the speed of flow changes at different parts of the systemic circuit. And I have a really nice diagram to illustrate this right here. So what we see is that the speed is fastest at the aorta and slowest at the capillaries. Interestingly, the speed slightly increases again in veins. Why would this happen, you may ask? Well, the speed depends actually on the cross-sectional area as shown on this diagram that we can combine to the one below. Notice how the largest cross-sectional area of vessels is at the capillaries, so the blood speed slows down here. And this is, of course, useful since it facilitates the exchange of materials here. We have already talked about pre-capillary sphincters in our earlier videos on this chapter, so I will leave it for now on this topic and just refer you back to those videos. Just note that they control the blood flow through capillaries. I will mention, though, a few points about capillary exchange. So the exchange can happen by simple diffusion. Remember, this was the movement of materials down the concentration gradient. So in this example picture, the food color put in one corner of a glass slowly spreads evenly to all of the content of the glass. Or some of the exchange can happen through fenestrations. Remember, these were little window-like structures as the walls of the capillaries. Or it could be due to active transport. This is where we use either various pumps or vesicles to transport larger molecules across. Do note that on a larger scale, the total movement of fluids in and out of blood vessels should be balanced. And these two forces were called our osmotic and hydrostatic pressures. So let's bring in a little clinical relevance to this. Well, an edema is what happens when there is more fluid leaving the vessel than getting reabsorbed. So think of the diagram that we just saw about the balance of osmotic and hydrostatic pressures. And edemas can be problematic beyond just swelling. So we need to be mindful of those and what is the underlying reason behind one. There are a few important points that I want to highlight before we wrap up this video. Firstly, do note that as a rule of thumb, it is arteries that run deeper in the body. This makes sense if you think about it. In this way, they are maximally protected from being injured or cut, resulting in rapid loss of blood volumes. Then also note that it is especially the veins that have this adaptation of having many alternative routes. This is useful if there is, for example, a blockage somewhere on the way. And finally, do note that both brain and intestines have unique venous drainage arrangement. And especially that the nutrient-rich blood from the intestines goes first to the liver in order for the energy to get stored. And this is where we will wrap up this chapter's lecture video material. I have some good exercises for you, so work through them on your learning management system.